Okay. Thank you. So, good morning. Today we are going to talk about prevention and control of HIV infection. This is a topic we should have covered last week, but we are going to do it today. And in this topic, we are going to look at disease control and disease prevention, as well as mechanisms that one can use to reduce any risk of getting HIV. Some of the aspects I'm going to look at have already been discussed in the previous lectures. So what is disease control? When public health experts talk about controlling a disease, they mean reducing the number of infections, the number of people currently infected, and the number of people who become sick or die from a disease in local settings. And this can be achieved through deliberate efforts such as vaccinations, medications, contact isolation, or other public health interventions. Now, when we talk about HIV and AIDS, controlling the epidemic means providing care and resources necessary to stop the virus from spreading from one person to another. Now, when we talk about disease prevention, this is the procedure through which individuals, particularly those with risk factors for a disease, are treated in order to prevent the disease from occurring. Treatment normally begins either before signs and symptoms of the disease occur or shortly after. It is therefore important for every student to be able to differentiate between disease control and disease prevention. Now, how can we reduce the risk of getting HIV? Some of these points, I say we have already looked at them in the previous classes, and I'm just going to pass through them. The first way of reducing the risk is by getting a HIV test. Why is this important? It is important, especially when people are engaging in sex, to talk to the partners to have a HIV test. When you know your status before sex, then you are able to take more protective measures or even make a decision whether to have sex or not in the event that the other partner is infected. Number two, abstain from having sex. Of course, this seems to be very difficult among young people, but is the most effective way of ensuring that HIV contraction is reduced. Number three, choose less risky sexual behaviors. Now, some people would argue that the vaginal sex and anal sex contribute largely to the spread of HIV, and especially when these are done without a condom. When we say we choose risky sexual behaviors, we are saying that we can employ mechanisms like use of a condom when we are having sex. It helps to reduce the chances of contracting HIV. Now, the other one is use of male and female condoms every time you have sex. Of course, this is very important, but again, this is a method that or a means that is applicable mainly to people who are not married, because sometimes you may not say that they need to use it. So it is case specific. If a person is promiscuous, it is advisable they use condoms out there. Limit the number of sexual partners. Of course, there are people who have multiple sexual partners. It is important to have limited number, or more specifically, get one instead of having so many. And for those who really cannot be able to control themselves, in as much as if they cannot limit the numbers, then they need to use other protective means such as using a condom. Of course, you know that when people get involved with multiple sexual partners, they increase the chances of contracting other sexually transmitted diseases. The other point is getting tested and treated for sexually transmitted diseases. Of course, it is important to insist that partners get treated for any sexually transmitted diseases, because this increase the chances of contracting or even spreading HIV to others. Another means is use of pre-exposure prophylaxis. This one is a prevention option for people who do not have HIV but who are at a high risk of getting it. PrEP involves taking specific HIV medication every day to reduce the risk of getting HIV through sex or injection through drug use, or for people who use drug by sharing syringes and the like. For more information, if you want to get details on pre-exposure, you can follow the link provided there. The last option is do not inject drugs. Of course, we may not say do not inject, but we can say that avoid sharing for those, because of course there are some people, whether you say don't, they will. So for the sake of those, we would say avoid sharing those injections with people who are infected. And more specifically, if that is impossible, they can be cleaned before they are shared. How can I prevent others from passing, or how can I prevent passing HIV to others? Of course, if a person is already infected, there are also ways through which something can be done by taking HIV medicines daily. These are called antiretroviral therapy, or ART, and it helps people with HIV to live longer, healthier lives. And they cannot cure HIV, but of course what they do is they reduce the viral load in the body. One can get the main goals of ART, or one of the main goals of ART is to reduce a person's viral load to an undetectable level. So people who continually use them and follow the guidelines that they keep taking it every day, then of course their viral load can go too low so that it is not even detected. Now, such people can highly reduce the risk of passing HIV virus to others. Now, here are some of the steps. I think I have already mentioned about them. If you inject drugs, don't share needles and syringes. Use condoms correctly. Take your partner or talk to your partner about HIV or PrEP medication. Of course, my advice would still be that if you are not infected, please make an effort so that you don't get the virus. Now, there is something I would wish that you try to research on. What are the challenges of using ART, antiretroviral drugs? Also, with regard to this topic, I would be interested in that you look at, or you try to figure out, what are some of the challenges of people getting some of these preventive measures we are talking about? We also have post-exposure prophylaxis. Now, this one is a means for whereby, assuming somebody is exposed to HIV virus, within 72 hours, they can be given post-exposure prophylaxis. Now, it should only be used under emergency conditions. It is not for regular use. Now, this one is also common among the medics, because you realize that as they take care of the sick, they have higher chances of contracting maybe this virus. Should that happen, then of course they can take PEP. So there is a difference between PEP and PrEP. I hope you can be able to pick the difference. PrEP is before and it is taken frequently. PEP is after. Assuming like rape cases, people who have been raped, they can be given this kind of measure, or post-exposure prophylaxis. The last one is prevention of mother-to-child transmission of HIV. Of course, here, pregnant women with HIV take HIV medicine for their own health and preventing the transmission to the baby, the unborn baby. Of course, after birth, babies born of women receive this HIV medicine to protect them from infection from any HIV that may be passed from the mother to the child during birth. I urge you, students, to find time to look at the challenges facing people with HIV with regard to accessing some of these preventive measures. Or rather, is everyone able to get these measures? And if not, what are the factors that contribute to these people not getting such kind of care or such kind of protective or means of controlling HIV and AIDS? Now, the last topic for this unit is the ethical issues in HIV research and HIV care. Ethical issues. The first thing you need to know is what are ethical issues. There are some things, for example, you hear, if today we said we want to start slaughtering what? Something that is questionable, like we want to start eating dog meat in Kenya. There are issues that would tend to come up surrounding the eating of dog meat. These are the ones we are talking now as ethical issues. When we are dealing with human beings, there are certain issues that come up, so that we have to be very careful when handling humans. Of course, we know that HIV and AIDS and its care and even treatment revolves around human person. We are asking ourselves, what is acceptable when we are dealing? I am using Raymond's language to try to bring out this. What is acceptable when we try to handle HIV victims, and what is not acceptable? How far can we go in as far as we relate with people suffering from HIV? Of course, you know that Sub-Saharan Africa has the highest proportion of individuals with HIV and AIDS, of course, and the disease can progress or has progressed so much because of the various challenges that are there. You also agree with me that there is a high chance of taking advantage of people who have HIV, either when we are trying the drugs, or either when we are testing them, or when we are using some, we want to prevent the disease, so we tell them, we are going to inject you with this, and then we give you time. So there are possibilities that such people suffering from HIV can be misused, can be abused. So when we talk about ethical issues, we want to look at issues that govern HIV and AIDS research, as well as the care for the HIV and AIDS victims. Now, there are certain ethical issues that need to be considered, and I go right away to the basic ethical principles. Now, the common ones include autonomy of individuals, beneficence, non-maleficence, and justice. These ethical principles are very important when healthcare providers are dealing with HIV and AIDS patients. Now, we go through each one of them. Autonomy of individuals. What does that mean? Now, this one involves respecting the independence in decision making and protecting those who lack decision making capacity and can be vulnerable. This also includes a commitment to treat individuals with respect, to include confidentiality. In other words, we are saying that the person who is being treated, in this case the HIV victim, must be protected because they are very vulnerable. Remember, if they don't get this treatment, they are likely to die very fast. So somebody can come up and take advantage of them. You see, if you don't agree to what I say, then you go. Now, there is this ethical principle which we are saying that they have to be protected even when they have no capacity to make independent decisions. They are very vulnerable. So this principle simply means that an informed, competent adult patient has a right to refuse or accept treatment, drugs, and surgeries according to their desires. Of course, it is risky. It is a risky ethical principle because if somebody says, I will not take medication, you cannot force it through them. And again, such people, of course, will increase the risks. But that is how it is. People have a right to control what happens to their bodies because they are free and rational, and their decisions must be respected. Now, of course, it goes without saying that when we have a say to what we want done to our bodies, it can be of benefit, or it can be to our disadvantage. We have an obligation, however, to respect the autonomy of other persons, which is to respect the decision made by other people concerning their own life. This is also known as principle of human dignity. And it gives us the negative duty not to interfere with decisions of competent adults, and a positive duty to empower others for who we were responsible. Of course, there are challenges. Now, as we go through these ethical principles, I want you to also think about the advantages and disadvantages of these ethical principles. Because, for example, if a person has this virus and decides not to take medication because of this individual autonomy, then it goes without saying that such a person is likely to predispose other people to the virus by the fact that he has refused to take any medication. Now, principle number 2, ethical principle number 2, beneficence enforces a responsibility to act in the best interest of individuals or research participants. Now, this requires that the risk of research are minimized so that the potential benefits of research outweigh the risk. In other words, we are saying that even as we research, even as we do trials with these HIV and AIDS victims, it is important to be responsible so that even as we research, the benefits that come out of that research is more than the risks that are likely to result. All healthcare providers must make every effort to improve their patients' health, to do the most good for the patient in every situation. But what is good for one person may not be good for the other. So each situation is case dependent. It depends on the individuals that are involved. Also, other values that might conflict the beneficence may need to be considered. For instance, while positive steps are taken to prevent harm, adopting this principle can place healthcare providers into conflict. with other persons. So some of these ethical principles are quite tricky, especially when the intended outcome by the healthcare provider is for the good of the patient, but some people may never see this good. Number three, ethical principle number three, non-maleficence. This principle of bioethics asserts that there is an obligation not to inflict harm intentionally. First, do no harm. So when harm cannot be avoided, there is an obligation to minimize the harm and not to increase the risk of harm to others. When combining beneficence and non-maleficence, each action must produce more good than harm. And finally, the last ethical principle is justice. This requires individuals must be treated fairly, including fair selection and distribution of participants within the research recruitment. In other words, we are saying that when, for example, people are being recruited for trials, there should be justice, and especially when we foresee that more people are likely to benefit from that particular treatment, then it should be fairly done. For example, you don't just focus on those who can afford and ignore those who can't afford. Of course, you saw what happened to the COVID-19 vaccine. People who are weak or people who had no money, of course, were dying like flies because they could not get to some of the medications that were necessary. Now, we are saying that individuals must be treated fairly when it comes to treatment of HIV and AIDS. Now, some of these principles, of course, in as much as we are saying they have challenges due to cultural issues, there are certain cultures that might say, in our culture, this is not allowed, or other people might say, in our community, this is not important. So there are challenges surrounding application of some of these principles, but nevertheless, they are widely accepted internationally. Now, I want us to look at ethics in clinical care and management of HIV and AIDS. We have just looked at the basics. The first part was just general principles. What really a care provider needs to consider when taking care of all when interacting with a HIV and AIDS person. You see, there is a person who can say, I don't want to be tested. That is a right. They have a right, individual autonomy. But we have said that can compromise. So there are certain other ethical clinical care or ethics in clinical care and management, whereby as we care for the victims, again, we need to look at certain aspects. And the first one is confidentiality. Today, if a person wants to go for a HIV test, confidentiality of such medical information is very important. Of course, today we know that people don't, the degree of stigma is not as high as it were in previous years. But still, confidentiality with medical information is very important, is an ethical consideration, and it must be protected under the law. This information is very sensitive, so somebody cannot just come and pick the information and distribute it to people. For example, HIV information may not be disclosed based on the general release of medical information. Specific authorization for release of HIV-related information must be released. Confidentiality is a finite concept which either maintained or breached regardless of the patient's data involved. So in some countries, when you breach this principle, or when you reveal that the person is sick and it is not supposed, then it can warrant sanctions. Of course, there are exceptions when a person can, or this confidentiality can be broken, or where we consider that a person may reveal the HIV status, or a medic can reveal the status of HIV of a patient. This can happen, of course, when we are talking about the government getting data about the number of people who are sick for purposes of planning. We are saying that there are sometimes the surveillance. People, or the medical people, or the government want to know the number of individuals who are sick. They may not get the name, but they want to know the number of infections within a given area. Of course, that has to be released. Such information, that is why we are saying exceptions to legal and ethical obligation to maintain confidentiality exist. Number one, when public health authorities require the information. Of course, they don't require information about you as an individual, but maybe they require the numbers of individuals that are infected. That way, such information may be released. Another time when confidentiality may not apply, a healthcare provider may also be permitted to disclose HIV status of a person if the person risks infecting other people. Of course, if a person is maybe a criminal and he has the tendency to infect people in the village or wherever he goes, then of course such information can be diverted to the public or to the security measures so that people can take care of themselves. Another time that confidentiality may be breached is the concept of privileged disclosure between colleagues should be introduced. In other words, we are saying that assuming this is a partner, a person is involved with another in a relationship, then of course if we say we be confident, we apply confidentiality, then again we expose other people to the virus. So it is important that at some situations this consideration of, or this ethical consideration of confidentiality can be overruled. Another exception for the general rule of confidentiality of HIV-related information concerns healthcare providers. You know, healthcare providers may get this virus. Of course, you cannot say that it will not be known they have the virus. So, based on the circumstances surrounding their nature of work, they may have to disclose, like the dentists, people who remove the teeth. If they have the infection, of course, we know that their chances of transmitting the virus to other people is minimal. But again, we are saying that in some areas, professionals who get the virus may communicate, or their information may be diverged, and a bit of monitoring may be done. Now, the second ethical issue under care and management of HIV is informed consent. Informed consent has to do with you agree to what is being done. A decision to participate in research, for example, if we want to pick some patients and use them for certain trials, they should have information about what we are going to do. I'm trying to simplify what is highlighted in yellow. A decision to participate in research taken by a competent individual who has received the necessary information, who has adequately understood the information, and who, after considering the information, has agreed or arrived to a decision without being coerced or being under any intimidation. In short, we are saying this. If a person wants to be involved in trials, because in most cases is either drugs, you are trying certain effectiveness of a certain medication, people who are going to be involved in this trial, they have been informed what is going to be done, and then they have even been told the possible outcomes, the risks and the benefits, and that they are not coerced. Nobody is forcing them to get involved in this trial. Why is this important? Because some of these trials, remember we are talking about care and research, some of these trials may come with a risk, whereby the risk can be there is damage of some body organs, or they can even resort to death. So before somebody is involved in research or those trials or whatever it is, then they have to have informed consent. No one is pushing them to whatever exercise they are being told to do. Informed consent is based on the principle that competent individuals entitled to choose freely whether to participate in research or not. Informed consent is received by the researcher from research participants before conducting the study. So before the study starts, then of course the participants or people who will be involved in that research must agree that yes, we want to do ABCD, we want to participate. Now, individuals need to continue being informed about any changes. You know, people sometimes, researchers can be tricky. They can change the study along the way. If that happens, the participants should be informed of any changes, and then they still have the opportunity to decide whether to continue with the study or not. So in this case, willingness of the individuals is very important. Coercion should not happen. And when we talk about informed consent, adequate time must be given to research participants to consult before giving their informed consent. And of course, this one should be documented in a language that they can understand. You realize that many researchers, when they do research, they go to people in the village whose level of understanding is quite low. We are saying that the consent should be drafted in very clear terms so that individuals are able to understand what exactly is expected of them. So students, that marks the end of our lesson or our topics about HIV and AIDS. Please remember that today we have looked at prevention and disease control. Remember, we said it's important that we are able to differentiate the two. We have also looked at ways you can reduce the risk of getting HIV. And I said under this, you need to know the various ways that can be used: testing, abstaining, less risky behavior, limiting number of sexual partners, using condoms. We also talked about PrEP. We also talked about not injecting drugs. We also talked about PEP, that is post-exposure prophylaxis and prevention of mother-to-child transmission. Under that, I remember saying that we need also to think about the challenges. Why do some people get, others don't get? And then we also mentioned that in the event that a person is sick, the best way of reducing the spread of this virus is religiously taking the ART. And I also want you to think about this very keenly. What are the ethical issues surrounding the use of ART, antiretroviral therapy? Please find time to research on that as well. Is an assignment that I would wish everybody tries. What are the ethical issues surrounding the use of antiretroviral therapy. There are issues. Kindly, now that you know what ethical issues are, please find time now to go online and research on that. So with regard to the clinical ethical issues, we have looked at the basic ethical principles, that is autonomy of individuals, beneficence, non-maleficence, and justice. And we have also looked at the ethical issues surrounding the care and management of HIV, which include confidentiality and informed consent. Unless someone has a question, I wish to thank you for taking time to listen to me. I would also want to inform you that you still have to meet for your tutorials today. Group D, I think I may not manage to come for the tutorial, but I will get to you through the WhatsApp group, and we are going to share more with regard to what is expected of you. Have a good morning, and please keep revising for Cat 2. Your fellow lecturers for the various tutorial groups will give further details during the class. So please attend, because we still have to agree on how we conduct our Cat 2. Kindly make sure everybody attends the tutorials for the other groups. I'm saying for Group D, I will get to you through the WhatsApp group. Have a good day. Thank you.